I'm Richard King, and I've lived comfortably with diabetes for over 20 years. When I first heard the diagnosis that I had diabetes, everything you've ever thought about that's happened to someone that you knew that had diabetes, everything that you know could happen if you don't take care of yourself run through my mind.
3 of the biggest dangers of having uncontrolled diabetes is your increased risk of heart attacks and strokes. You can also have damage to your kidneys. You can also damage your nerves. Type 2 diabetes is a preventable condition. So by starting early and trying to live a healthy, active lifestyle can help prevent this from happening.
When I was first diagnosed, the doctor threatened to put me on insulin. I said, well, let me have a chance to do something about this myself, change my eating habits and lose some weight. Over the next 30 days, I lost 30 pounds. Drastically changed what I ate. Went back to see the doctor and didn't have to take insulin.
I've known Richard now for almost 4 years. He really took the initiative to change his lifestyle. He's exercising almost every day. He's eating healthy. So not only by making these changes has he improved his diabetes, but overall he has a better sense of well-being.
It's all what you decide you want to do and how you want to live your life. I wanted to lose weight and I wanted to be healthy. And today, with the exception of saying I have type 2 diabetes that's very well managed, I am a very healthy individual. She understood what my health concerns were and what my needs were, and she shared some thoughts with me on how we could go forward and manage my diabetes.
How are you?
I monitor my blood sugar numbers on a regular basis and share those with her, and we're able to track where I am from a health perspective.
When you take a partnership approach, the patient is more invested in their health, which typically translates to better outcomes.
I think the biggest challenge is getting the mindset to that the things you don't have that you used to enjoy really aren't that great, so that you really don't miss them.
I'll see you in 6 months.
Everybody has to evaluate their own life and what they want, and they have to make a hard choice to change their lifestyle, become active, change the way you eat, and monitor your sugar levels so that you can live a long, healthy life. So it's imperative that you attack it that way and say, this is for me.
Type 2 diabetes is something that you really do live with for the rest of your life, but it is important to monitor. So even once it does get to that controlled point, you still want to come in on a regular basis, you still want to check your blood sugars, you still want to eat healthy, but it is something that you can live a healthy, active lifestyle with.
My quality of life is great. We're retired, and we're doing the things that we want to do together, my wife and I, and enjoying every minute of it.